I think a lot of this stems down to the emotion of things. Women tend to be a little bit more emotional versus men. We take things a little bit easier. It's a lot easier for us to keep the baggage and you could say drama in the workplace, because a lot of times we really don't care. We don't really care. We're there to just come in, do our job, and leave. Come in, get paid, leave. Help as much as we can. So that's that one major thing. I think it's just emotion. Even for dealing with like sick patients, lots of times I dealt with the nurses crying, going through this emotional roller coaster, really taking what's going on with the patients to their hearts. And I've never had a problem with, you could say, disassociating myself from the patients and what the family is going through. I've just always been lucky enough to be able to deal with that a little bit easier. But I know a lot of times, y'all women out there, you guys really struggle, and that's what makes you beautiful in that way, is because you're so caring and you're very emotional to these things. That's what makes you a really beautiful and amazing human beings. That's why I respect women, because they could put this emotion into somebody that they love, somebody that they don't even know, and it goes really far. You girls could relate to patients a lot better. You could relate to family a lot better. A lot of times you break the news a lot better than men, because you have this very beautiful emotional side to you where you're just naturally gifted and good at that. But this is with everything, there's a positive and a negative. Lots of times you are overwhelmed with these emotions about what's going on at work, and it translates to the home environment and all that kind of stuff. But same with the guys. We struggle with emotions, so it's a lot easier for us to dissociate with our patients and what's going on. But then at home, our girlfriends, our families, it's a lot harder for us to get super close on that emotional level. So there's always two sides of the story, always a positive and negative. And that's kind of what makes us work so well with each other, because we compensate for our flaws, for our weaknesses. And the strengths of the women compensate for the flaws of the men, and the strength of the men compensate for the flaws of the women. That's why we're so good at starting family. That's why we're so good at communication. That's why nursing is such an interesting dynamic when you have a male and a female, because you have both this emotional side of things, but then you also have this straight shooter kind of things. I feel having a little bit of a more diverse male and female nursing environment goes a long way, to be honest, with leadership, with just the more of the patient perspective, the one-on-one kind of things, because you girls are really, really good nurses. I want to tell you that the best nurses that I've worked with were all females. The best nurses I've ever seen in my life are females. It's because this field is made for you. Us guys, we're trying to fit into it a little bit in some way. We're trying to make our presence known and just kind of squeeze in to it, so we feel like we're in a good field for us. But we're the outsiders coming in and trying to make it our home. Versus y'all women out there, this is your home. This literally is your field. This field wasn't made for women, and I appreciate all the female coworkers that I have worked with.